Okay, everyone, today we are going to learn about the sterilization and the disinfection. Let's begin with simple definition of sterilization, disinfection, sepsis, and decontamination. Okay, what is sterilization? Sterilization is a process to remove the all living microorganism, including the spores. These spores and microorganisms are destroy or remove from article, body surface or medium by using physical and chemical agent which are called chemical sterilant. This agent result in the reduction of at least 10 to the power 6 cloniforming unit. This is called sterilization. Simply, it is the process by which all living microorganisms, including spores, are destroyed or removed from an article, body surface, or medium. And another is disinfection, similar to sterilization, but in disinfection, we cannot remove spores or cannot destroy spores. This disinfection result in the destruction or removing of pathogenic organism but not a spores. Those physical or chemical agent by using which we can achieve this disinfection is called disinfectant. This result in the reduction of at least 10 to the power 3 log cloniforming unit. Please make here correction 10 to the power 3 log cloniforming unit. Normally, this disinfection is not used on body surface. This disinfectant is mostly applied on inanimated object. Please note down, this disinfection or disinfection is only for inanimated object, and this disinfectant is not applied on body surface. And note down that disinfections can only remove or destroy the pathogenic organism but not a spores. And another term is asepsis. What do you mean by asepsis? Asepsis is a process where we use chemical agent to either kill or inhibit the microorganism present on skin, and this can be applied on body surface because it is not toxic as disinfectant. And another is we mostly known during the time of COVID, that decontamination, sanitization, and this means decontamination and sanitization means to reduce the load of pathogenic organism to that level where we can use or handle the equipment safely without using any protective barrier or agent or attire like PPE gloves. This only reduces pathogenic organism to a lower population. It doesn't completely kill, but reduce to a lower population or level at which we can work safely without having any risks during working. That condition by which we achieve is called sanitization or decontamination. Let's know some suffix and meaning. Here we see site. One is site, CID, site, suffix site. Site means, always remember that site means that agent which can kill microorganism. For example, bactericide, virucide, fungicide. Site means to kill. Okay. And static, another is static. This static means to just inhibit but not kill, just inhibit the growth of organism but not kill. For example, bacteriostatic, fungistatic, these are the example. And always there is factor influencing the efficiency of any product we use, like in sterilant or disinfection condition. There is also a factor which influence the efficiency. Working capacity of sterilant and disinfectant is altered by some factor, and we talk about that factor in simple way. We to the point uh, notice provided here. You can see here, number one, load of organism. If the organism load is high, large, it requires large time to kill that organism or destroy that organism. And the nature of organism, yes, disinfectant efficiency or efficacy can be altered by the nature of organism. Some organisms are resistant to disinfectant, some are sensitive at the same concentration also. So look here, it is given simple order. More resistant is pyrons, then after cryptosporidium oocyst, and then bacterial spores. Always remember that bacterial spores भन्दा पनि अझै resistant छ, more resistant than bacterial spores, that is pyrons. And mycobacteria then, and small non-enveloped virus. Always remember that non-enveloped virus is more resistant than enveloped virus. Then after gram-negative bacteria, fungi, gram-positive bacteria, and enveloped virus. This is the order of resistance in decreasing order. Mostly resistant, highly resistant, what is? That is pyrons. Then cryptosporidium oocyst, then bacterial spores, mycobacteria, small non-enveloped virus, gram-negative bacteria, fungi, gram-positive bacteria, and enveloped virus. Another factor is concentration. Okay, concentration also matter. So for example, we use 70% alcohol, yeah, for disinfection. Why we don't use 100%? Though the concentration of 70% is less than the 100% and 100% is more concentrated form, why we are not using the 100% alcohol? Why we are using 70% alcohol? The meaning is that we look for contact time. Contact time means for how much period this disinfectant remain on the surface of organism. If you use 100% alcohol, it is highly evaporated, quickly evaporated, and contact time is reduced. But if you reduce the concentration to 70%, the contact time is increased. So we use the 70% concentration of alcohol rather than 100%. Okay, this concentration and time also matter for the disinfection. Nature of chemical or sterilant or disinfectant we use. We know that the nature of sterilant and disinfectant, we know it should be have some characteristics. What are these characteristics? These are its microbicidal activity, rapidity of action, ability to act in the presence of organic matter. In the presence of organic matter, the disinfectant or sterilant what we use should show its activity. It should not be interfered by the organic matter during the disinfection. Okay, another is the temperature. Increasing temperature increase the activity of sterilant or disinfectant. Yes, temperature, increase in temperature increase the activity of sterilant or disinfectant. And others are the environmental factor or local environment. What are these? These are pH. Low pH kill more rapidly than the high pH. Organic matter. This organic matter protects the organism from the disinfectant. Suppose it disrupt the penetration of disinfectant into the organism. So organic matters also protect. It's a factor which interfere the activity of sterilant or disinfectant. And there is biofilm. Oh, very important things, this biofilm. What is this biofilm? This biofilm is a protective slimy matrix of extracellular polymeric soften. where the bacteria is invented themselves and they is secreted by themselves, and the protein they product sorry they product sorry 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 they protect themselves from this disinfectant, Westerland, yes, also from the antibiotic too. By secreting this slimimetric layer outside them, they resist the entry of disinfectant or sterilant, and this protect them from this activity. Uh, I hope you understand this. Simple. Sterilant, disinfection, asepsis, decontamination, or sanitization. These are the term and factor influencing these are lack of or load of organism, nature of organism, concentration, nature of sterilant, disinfectant, temperature, local environment. And another is methods. What are the methods? Methods are the procedure or things by which we achieve this all condition, that is sanitization or decontamination, asepsis, disinfection, sterilization. By this method we achieve these things. The method is divided into two. One is physical method and one is chemical method. What is physical method? In physical method, it consists of drying, filtration, heat, radiation, and heat is again divided into dry heat or moist heat. Dry heat contains flaming, insolation, hot air, and moist heat at different temperature. Less than 100 degree pasteurization, water bath, infusion, 800 degree boiling, steaming, thermalization, more than 100 degree autoclave, which most frequently uses autoclave and the hot air oven. And the chemical methods include the chemical agent such as alcohol, aldehyde, phenolic compound, halogens, and ethylene oxide, many more. Let's begin with the physical methods. What is drying? As we know that 70 to 80% weight of bacteria is due to water, so they require the moisture for their growth, survival. So drying, so when we dry them or dry by using sunlight, this has a deleterious effect on many bacteria, but this method is not a reliable method. So what are the reliable methods? The reliable method is the heating method, heat method, most commonly used method, reliable method, and we use two type of heats. One is dry heat and one is moist heat. What is the dry heat? How mechanism action of dry heat? Okay, let's see. Dry heat. How does this kill the microorganism? Dry heat kills the organism by charring or burning, denaturation of protein, oxidation damage, and toxic effect due to elevated electrolyte. What does it do? It does organism or kills the organism by charring or denaturation of protein of bacteria, or by oxidative damage, or by increasing the electrolyte, which result in the toxic effect. And the moist heat. What does this moist heat do? How does it act? This moist heat kill organism by denaturation and coagulation of protein. It directly attack the protein. And there are different type of method under the dry heat. Let's begin one by one. First is the flaming. In flaming, in Bunsen burner, we what do we do? In Bunsen burner, in the blue burner, in the blue flame, what we held, that is items such as inoculating wire loops we held on a Bunsen burner till it become red and hot. For those items which should be red and hot is inoculating wire loops. But we cannot make the test tube red and hot. The mouth of test tube is only held in flame for certain short period of time, so that the mouth is sterilized. And flaming is not most effective, but it can be used for the inoculation wire loops during culture or during inoculation. It can be used. And another is the insertion. What is mean by insertion? Insertion mainly used for the biomedical waste, mainly for anatomical waste or microbial waste. In insulation, at very high temperature, about 870 to 1200 degrees Celsius, what we do this, we burn that biomedical waste into the ash, and it is called insulation. And another method is hot air oven. It is most commonly used method of dry heat. Most widely used method by dry heat. This hot air oven consists of electric system or um, electrically electrical heater or electrically heated, and it is also fitted with fan which distribute equal and adequate hot air in the chamber. There is also a thermostat in the chamber. Thermostat is attached to maintain the temperature of hot air in the chamber. According to our wish, we can maintain the temperature in the hot air chamber. Okay, the holding temperature and time is 160 degree for 2 hours. This is the holding temperature and time. Materials which we can sterilize in hot air. What does this materials means, and what are the example? This glassware, surgical instrument, chemical जस्तै paraffin wax, glycerol fat. These are the chemicals which can be sterilized on hot air. The material should not be flammable. Inflammable materials should be kept in hot air oven. Flammable materials are not allowed. We cannot put the flammable materials. But remember one thing: after complete sterilization, after holding period and temperature, do not suddenly open the hot air oven. Allow it to cool for 2 hours. If we open suddenly hot air oven, it can harm personnel which is going to open the hot air oven, or the instrument or glasses which are sterilized can be break, crack due to the sudden change in temperature. We know, to every instrument we use, we should always use control materials for that, to check whether the instrument is working currently or it is working or not. The controls will be always kept. For this hot air oven, most commonly used control is spores of Bacillus atrophius or Clostridium tetani. These are the spores can be used. They should be killed during this holding temperature and time. So we can say that the hot air oven is working, otherwise it is not working, useless. Okay, and another is the moist heat. By moist heat, we can achieve sterilization at 3 different temperatures: at below 100 degrees Celsius, at 100 degrees and above 100 degrees Celsius. What are the method at 100 degrees Celsius, below 100 degrees Celsius? Below 100 degrees Celsius, it is pasteurization, mainly used for the control of microorganisms in beverages like fruit, vegetable juice, beer, dairy product like milk. Holder method and flash method, two type of method of pasteurization are available. In holder method, the holding time and temperature is 63 degrees Celsius for 30 minutes. In flash method, 72 degrees Celsius for 20 seconds, followed by rapid cooling at 13 degrees Celsius or low. Remember that. Coxella burnetii may survive in the holder method. This is the bacteria which survive on this holder method. And water bath. Water bath is mainly used for serum, body fluid and vaccines. For vaccine, holding temperature and time is 60 degrees Celsius for 1 hour, and for body fluid 56 degrees Celsius for 1 hour. And ISPI session. What is this ISPI session? In this inspiration method, this article is heated for 3 successive days at a temperature of 80 to 85 degrees Celsius for 30 minutes. During first exposure, vegetative form is destroyed or killed, and between the interval, again the spores germinate to vegetative forms, and again this vegetative form is destroyed. By this, we can achieve the sterilization. The instrument used for inspiration is inspicator. What is inspicator? What is called inspicator? Mainly done for the egg-based medium like algae medium, dorsate egg medium, and serum-based medium like low force serum slow. What is used for Corynebacterium, diphtheria, and algae medium and dorsate medium mycobacteria. Now moist heat 800 degrees Celsius. It includes the boiling, steaming and tenderization. Boiling. In this item are boiled in water for 15 minutes. Not much effective this method is. Steaming. Articles are put on the perforated tray. Perforated means there is certain pores from where steam can be passed outside, and these items are exposed to steam at 100 degrees Celsius for 90 minutes. Thermophiles and spores are not kills, only vegetative forms are kills. Thermophiles and spores are not kills. And tenderization. It is similar to the inspissation, but in tenderization temperature is increased to 100 degrees Celsius, but in inspissation it is done at 80 to 85 degrees Celsius. It is also done for 30 minutes. If it's done for 30 minutes, it is done for 20 minutes for 3 successive days. Okay. And there is the moist heat above 100 degrees Celsius. This autoclave, it is most commonly used method. In most of laboratory, we see the autoclave. What is this autoclave? It is similar like pressure cooker and functions similar to the pressure cooker and follow the law of gas. What is the law of gas? We know that water boils when its vapor pressure is equal to the atmospheric pressure. When the atmospheric pressure is equal to the vapor pressure, only water boils. But when the atmospheric pressure is raised or increased, the boiling point of water also increase, temperature also increase. Normally water boils at 100 degrees Celsius, but in autoclave we what we do, we keep water in a closed vessel and increase that temperature. When the temperature inside the vessel increases and when the temperature surrounding temperature increases, now water doesn't boil at 100 degree. The temperature is also increased for boiling of water, and that is the principle of the autoclave. Autoclave functions similar to a pressure cooker and follow the general law of gas. As we know, water boils when its vapor pressure equals to the atmospheric pressure. When atmospheric pressure is raised, boiling temperature is also raised. Normally, water boils at 100 degrees Celsius, but in autoclave, when pressure inside closed vessel rises, the boiling temperature also rises for water, and this is the principle of autoclave. What are the part and component of autoclave? Autoclave consists of pressure chamber, lid, and an electrical heater. And a pressure chamber consists of large cylinder. This cylinder can be vertical or horizontal. The cylinder is made of gunmetal or stainless steel, placed in supporting case of iron. Steam jacket or water compartment is also present in pressure chamber. This is generally attached to the pressure chamber. Lid. What is lid? This is the lid. Lid is fastened by screw clamp. Here we see the screw clamp to close this lid, and this lid should be airtight, which is maintained by the asbestos washer. Washer is used, and lid include some tube, like one is discharge tap for air and steam discharge, pressure gauge for pressure setup, and safety valve for removing excess steam during the autoclave process. Before we start autoclave, when switch on autoclave and put all the material there, we allow some air inside the autoclave to pass out through this discharge tap, and after a certain time we close this discharge tap, and what there happen, there increase the pressure and the steam, the heater hit the water and the steam come out, and this steam sterilize the content what we kept on the autoclave. And there is the electrical heater. This is attached to the steam jacket or water compartment. Heat the water to produce the steam. And the sterilization condition most commonly uses 121 degrees Celsius for 15 minutes at a pressure of 15 pound per square inch. This here look once, as the pressure increases, the temperature also increases. Pressure increase, temperature increase. So other conditions are also useful. For example, if the pressure is 20 psi, the temperature is 126 degree and the time is decreased. If the pressure increase, temperature also increase. Look here, 30 psi, temperature also 130 degrees Celsius for 3 minutes. These are the sterilization condition which we can set up on the autoclave and we use. For what purpose we use the autoclave? Autoclave can be used for the plastic tube and pipette tips which we cannot be sterilized on the hot air oven but can be sterilized here. Surgical instruments like forceps and culture media, solution and waters are also sterilized on autoclave. This is manual autoclave. Small autoclave is consist of pressure gauge, safety valve, autoclave lids and handles. Here is the another valve, steam release valve, vacuum release valve, and here is stand, and here is the pressure regulating device. And the control for the autoclave is the spores of Geobacillus stereothermophilus. Previously it is called Bacillus stereothermophilus. External pack, one tape autoclave tape is available which we can attach on the material to be sterilized. And after complete of sterilization, if the color is changes on the tape, then we assume that our autoclave is working properly and the content which we going to sterilize are completely sterilized. And then there is the filtration. Generally filtration is not used in the laboratory but it is used in the drinking water. Mainly we see in our home there is the filtration mainly used for the drinking water. It is the excellent way to remove the microbial population present in the solution. Two types of filter are used, depth filter and membrane filter. One is depth filter. In depth filter there is pores. If these are the particles which should be removed, in depth filter this enter till the depth of the filter and certain particles are filtered. But in the membrane filter these particles settle only on the membrane, they are not allowed to enter to the depth. So this is the difference. Depth filter is not suitable for the bacterial solution, it is suitable for the bacteria filtration. Okay, depth filter is a porous membrane, retain particles throughout the depth, not suitable for the filtration with the solution which contain the bacteria. Membrane filter, particles remain on the surface of the porous membrane which are larger than the pore size. Those particles which are larger than the pore size, they remain on the surface of the membrane. They are not allowed to pass through the membrane. Mostly used for the bacterial filtration. Average diameter of pores mostly used is 0.22 micrometer. Viruses are not filtrated. There is no filter for filtration of virus, though they are very small. In their size is in nanometer. HEPA filter, high efficacy particulate air filter. The average pore size is 0.3 micrometer. If the bacteria or particles is greater than 0.3 micrometer, then they are filtered by the HEPA filter. If they are less than 0.3 micrometer, they are not filtered. They pass through the pore. And alpha filter, ultra low particulate air filter. The average size is 0.12 micrometer. This is better than the HEPA filter. Alpha filter is better than the HEPA filter. And the Serratia marcescens, Breviodimonas, diminuta are the control bacteria which are used for the filtration or checking. And another method is radiation. Two types of radiation we use. One is ionizing radiation and is non-ionizing radiation. Ionizing radiation includes X-ray, gamma rays, cosmic rays. These ionizing radiation have high penetration power, so they doesn't increase the temperature during the sterilization. So they are also called cold sterilization. They work by damaging the DNA. They damage the spores but not the virus. And non-ionizing radiation, they have low penetration power and can be lethal. And UV rays and the infrared are the commonly used non-ionizing radiation. UV rays generally wavelength of 250 to 300 nanometer is useful dose for sterilization. And then the last method is our chemical method. In chemical method we use different chemical agent to achieve the sterilization or disinfection. The most commonly used is the alcohol. This can be ethanol, isopropanol, used at the concentration of 70 to 80%. They are not able to kill the spores. denatured protein, and by dissolving member they act by that denaturing protein or by dissolving membrane. Mostly commonly used in hand drops. These are used in hand drops. And isopropanol is used for surface cleaning of instrument. Formaldehyde. Generally, this formaldehyde is used for preservation of anatomical waste in histopathology lab, but can be used for disinfection also. This work by combining with a nucleic acid protein and inactivate them by cross-linking or by alkylating the molecules. And generally 35 to 40% formaldehyde is available, which is used for the anatomical waste preservation in histopathological lab, or it can be used to fumigate the operation theater. That is used previously, but nowadays it is not used for this purpose. It is mainly used for the preservation of anatomical waste, that biopsy materials in histopathology. And 2% glutaraldehyde. This is available in inactive forms, need to be activated by the alkalization, and should be used within the 12 days after activation. Used for the endoscope and cytoscope. It is called cytoscopy. Cytoscopy used for cytoscopy. It is the method to view urethra and urinary tract mainly, and it is non-corrosive, so it is used for this instrument. Phenolic compound such as phenol, cresol, lysol to disinfect the hospital surface, and chlorogenol available as Dettol, used as antiseptic. Antiseptic means which we can apply on skin surface. Disinfectant is applied on inanimate object. It is not used on body surface. It is toxic, and it is worked by denaturation of protein and destroying the cell membrane, And the halogens such as chlorine mainly used for water purification, and iodine. 2% iodine is called tincture of iodine. It is used as antiseptic. It's worked by the oxidative damage. And sodium hypochlorite, mainly 0.5 to 1% of sodium hypochlorite is used in almost all lab for destroy slide, needle strings contaminated with a microbial agent. And the another is hydrogen peroxide. This hydrogen peroxide break H2O2 break here, and this liberated the hydroxyl radical. This radical attack the membrane, lipid, DNA and other component of cells and destroy them. For non-catalyst producing organism, 3 to 6% of H2O2 can be used, but in case of catalyst producing organism, they can destroy 3 to 6% of H2O2. So concentration increase 10% for catalyst producing organism and spores. And this is the detail about the sterilization and disinfection. Hope you enjoy it. Subscribe for better lecture, and always note this content which are provided here. This content are made for examination purpose, following different books, lecture and the articles. Very important note for examination, for all level examination, including Lok Seva, council examination, and also focus on the bachelor syllabus of medical lab technology. Hope you enjoy this.